22nd International AIDS Conference in Amsterdam, the 71-year-old musician and activist told CNN of his frustration at the lack of compassion and humanity toward groups most affected by HIV, such as LGBT communities. The stigma they face causes them to miss out on life-saving testing and treatment, he said. Maybe he could be the President of the United States who ends AIDS altogether. Why not? John asked, adding that no disease has had scientific progress like this disease. Nobody needs to die of AIDS anymore. Memories of Diana. On Tuesday morning, John took to the stage at the conference with Prince Harry, the Duke of Sussex, to launch a $1.2 billion partnership with the Elton John AIDS Foundation and PEPFAR called the MedStar Coalition. It will work creatively to boost HIV diagnosis and treatment among young men, focusing on those 24 to 35, among whom testing and treatment rates are low, endangering their own health and that of the people they have sex with. On stage, Prince Harry described how proud he was to join John, who has always put people at the center of his work. In return, John told CNN how Prince Harry had inherited his mother's ability to charm the pants of anyone and the value that brings to make people care about HIV and the people affected by the infection. He also spoke fondly of Harry's mother, Princess Diana, who he believes would be delighted at the progress in the field, adding that we'd have probably come a lot further as well if she were alive today. During her time advocating for people with HIV/AIDS, Diana broke down barriers, including by visiting and shaking hands with patients. John and his husband, David Furnish, said there are still many barriers to be taken down, namely around stigma and support for vulnerable groups such as injection drug users, sex workers and LGBT groups across Africa, Eastern Europe, and Central Asia. Rising HIV rates. On Tuesday, John announced the strategy and grantees of another recently announced fund to support key populations in Eastern Europe and Central Asia, one of only 2 regions globally where the HIV epidemic continues to grow rapidly. In Eastern Europe and Central Asia, more than 1.5 million people are living with HIV, and new infections have risen by over 50% since 2010. The epidemic there is fueled by a lack of government support, poor programs to aid people in diagnosis and beginning treatment, and high costs of antiretroviral treatment and treatment-related services, particularly for LGBT people, according to the foundation. John hopes that by showing what works to bring new infections down and provide support to those in need, governments will come on board to take on the problem. We've gone in and worked in slightly more controversial ways, working strongly with marginalized communities that people don't want to embrace. We get the results and we make a compelling case for it to be expanded, Furnish said. In most places, when a government sees it works, they come on board. I don't think there's been a country that we've worked in that it hasn't worked, added John, highlighting Ukraine, South Africa, and England. We do the work, they come on board, and then we work together, said John. That's the best way to do it. Fighting anti-gay laws. The foundation is showcasing results in sub-Saharan Africa, where an LGBT fund helps communities cope with being penalties and discrimination for being homosexual in their own countries. The $10 million fund has been in progress for 2 years and has reached almost 60,000 people across the region. That includes helping church clergy across denominations in Kenya with housing support, treatment and counseling for clergy who had been suspended and rejected after speaking out for LGBT members of their communities or identifying as LGBT themselves. Another project in Ghana provided secure accommodations and legal help to LGBT people facing threats of sacrifice for bringing taboo to their community. Anybody we see in distress who is treated unfairly, Furnish said, we have to speak out and support them. More than 70 countries criminalize same-sex relationships, so people are less likely to access HIV diagnosis and treatment facilities. They're 19 times more likely to be living with HIV, according to the foundation. John has seen how attitudes can change. I remember going to South Africa in Cape Town and setting up a helpline at the University of Cape Town, for students who couldn't talk about being gay or having AIDS or HIV because they would be thrown out of university, he said. Now, you don't get that anymore. Impact of friends and family. After more than 20 years each working in the field, what continues to drive John and Furnish in the fight against AIDS? Both referred to friends they lost early on in the epidemic. Progress made to end HIV/AIDS would mean that they didn't die for nothing, John said. We were profoundly affected by the people we lost, Furnish added, explaining that although progress has been made in some parts of the West, such as the UK, allowing him and John to marry and adopt children, he looks at the other side of the coin, where people are so marginalized by their sexuality and they don't have the privileges and benefits and joys that we have. We have to attack that head on, he said. Their 2 children, who have joined them in Amsterdam, are also a big part of their efforts. They're learning early on about the importance of charity and giving back. They have their own little bank accounts and pocket money that they give, said John. It's the young people who are changing the world. It's fantastic.